So welcome back to the last and final module of the Little Brushes Guide. Today we are going to talk about some of the tooth-friendly fines. Anything other than water is really not good for the child. So you might think a sugar-free squash, they're all acidic. So you have to have a look at your child's diet. It's really important, two things: sugar and acids. You don't want both of them, can cause a lot of damage if given on an everyday basis. I will be discussing a lot more about these in detail. But if you sugary food, most of the food, so you might think the biggest problems are honey, cereal, yogurt, all sorts of confectionaries, as you already know. Some things like ketchup's got toothpaste, honey, and anything sticky, gummies, toffees that stay on the teeth and not washed away by saliva are problems. You really want to be avoiding them. So you want to try and avoid sugary food and acidic food on an everyday basis. So anything other than water, like I said. So for my children, what I use is the Air Up bottle. It's a brilliant bottle. What it does is it's got a little pod that you put on the top. Actually, there are some cheaper versions of this. You can probably get it on Amazon. Anything's fine. Don't use, don't put squash or as your regular drink. Anything you drink once in a while is fine, but anything that you drink or you give the child on an everyday or every other day basis can cause damage on the teeth. So I just want to bring your attention to this again. So if you look at enamel is about 2 to 3 millimeters thick in where we bite at the back of the mouth. In the front of the mouth, about 1 to 2 millimeters thick, maybe sometimes a little bit more. But as it comes towards the gum, it becomes thinner and thinner and becomes 0.3 to 0.5 millimeters thin. So that's why when you brush in this area wrongly, you get dips, or we get toothbrush aberration. Now, like I was saying, the enamel's not that thick. And what the acids does is acids eat away your enamel layer by layer. It's not nothing in the teeth, so that means decay, tooth wear, none of that happens like this. It happens in a very slow progressing problem. But the thing is, enamel is your whitest part of your teeth, the strongest part of your teeth, and the best thing about the enamel is there's no pain because there's no nerves. All the nerves are right on the inside of the tooth. So if anything happens to this just on the enamel, nothing happens and no pain. So you don't want to wait for pain to treat your problem. Always make sure that you catch it early before there is any pain. The minute there's pain on teeth, that is because there is the red bit that you see is the nerves inside the teeth, but the yellow bit that covers the nerve is called the dentine. And the dentine is in the form of tubules, and into which the nerves from the nerve in the middle slowly comes up into the tubules. So that's why if the dentine is exposed, so wherever you brushed it away or where there's tooth wear, dentine is got nerves in the one end of it and sometimes can be makes it sensitive or painful. So it's not a good idea to lose your enamel. Now that you know about enamel and how thick it is, and so I said in the biting areas it's about 2 to 3 millimeters, but in this area, and on the insides of the mouth, it's about 1 millimeter thick. 1 millimeter thick is not that thick. So if you take, it's only as thick as a SIM card, or if you think of it as A4 sheet thicknesses, it's about 10 A4 sheet thicknesses for your child. Even if they have something acidic on an everyday basis and only lose 0.1 millimeter of enamel, that means one sheet of this A4 size sheet paper, in 10 years, they lose all of their enamel. That's the same for adults as well. So things that can be very acidic in the mouth, I'm going to go through a quick list so that you can, we'll be discussing this in great detail later on. Fizzy drinks, orange juice, orange squash, lime in water, lemon in water. So don't use those bottles with which you put lime or lemon or oranges in between. Please don't use those. Those are very, very acidic. Fizzy water, flavored water, pickles, gherkins, salad dressings, all sorts of vinegar, all sorts of energy drinks, Red Bull, Lucozade, Monster, all sorts of health drinks, kefir, kombucha, kimchi, and all sorts of alcoholic drinks are the usual acidic culprits in the diet, which is taken on an everyday or every other day basis, can cause damage to the teeth. But we'll talk about all this in great detail later. But for children, an Air Up bottle is brilliant because it's got these pods on the top which you smell. When you smell it, you feel like you're having flavored water, or whichever flavor that is. For those children who don't like water, I don't know why you think that. I think there was an era where everybody had squash, and now those parents obviously think it's okay to give the children squash, but now we know better, and so we wouldn't do that. So I would recommend it against it. The other thing is xylitol. Like I was saying, xylitol has been shown and proven to be one is it's a sugar-free option, so it cannot be digested by a bacteria to produce acid in the mouth. The second is it's got a property to actually inhibit the growth of the Streptococcus mutans, which is the decay-causing bacteria, or reduce its growth. So again, it is well recommended you use that in baking and things like that. If you are happy to use that, you don't want to use large quantities. I think it affects your stomach, but you can use it. And also even just putting it's like sugar. So you just put a little bit in your mouth and get the child to sort of rinse. If there's a high decay in any child, I would recommend just put a little teaspoon mouthful, ask them to keep it in the mouth for as long as they can, and swish it around and then spit out last thing at night, just to again reduce the bacterial count, reduce these decay causing bacteria, and avoiding problems. Then there are the same things, xylitol chewing gum, xylitol. So there's a different types that I saw online, which I am using, and I have given it to I am using it, and I give it to my children as well. Then the Smint ones, the Sterident ones, Trident ones, xylitol. I've just given a few options because in case you're in a different country where you can't find it. Xylitol Zollipops. Again, this is just like lollipops with xylitol. Again, it was a great hit at home, so we have used it. It is expensive for some lollipop, but it is something definitely not as expensive as having a filling, so that may be my recommendation. Just a heads up, Riz Recommends is an Amazon affiliate link, so if you buy any of the products that when I said buy here, I will get very low commission, but I do get a commission, and I've used affiliate links. It basically just helps me also understand what people are buying more, which is a good one, and for reviews. So I will be having an option for reviewing it on my website probably soon. So but you don't have to buy it from these links. I have put links because it just helps me advise my patients easier. So this is a table of everything that we have discussed. The one thing that I missed talking about earlier is that if there's a child that's got a high decay rate, that means there is a lot of decay in the mouth, the decay is not being controlled, sugar is high, then, or if the child is unwell or has got learning disabilities, then maybe you can increase the fluoride dosage in their mouth. So what is said is that from 1 to 10 years you can use a pea-size amount of 1450 ppm. Usually it's 1000 ppm for children. You can use the 1450, that means adult toothpaste, for children who's got high risk, and children over 10 years can go up to 2800 ppm of fluoride. Now those toothpastes are prescribed by the dentist, can only be given, at least in the UK, it is a prescription only product. We use Durafat, which is from Colgate. You can use if it's available, and you can be very careful. You can use that for 10 plus years child. Fluoride varnish is a high ppm fluoride gel that we apply onto the teeth, and it is well advised and recommended by all the countries' guidelines, especially all the Western countries where it's all based on evidence, and it's very well evidenced. Fluoride changes the hydroxyapatite on the enamel to pick up fluoroapatite, which is much more resistant to acid dissolution and makes it enamel stronger. So it is very well recommended that you have once in 6 months. I have it for my children, and that's why I'm advising it. Once in 6 months, high fluoride varnish to be applied on the teeth. And that's why you got to go back every 6 months to see your dentist. If you are not on a routine of 6 monthly fluoride varnish, that is something that I would definitely recommend that you can add to avoid problems on your children's teeth. A good regime for brushing is, most people get this in the wrong order. So you floss, you use the interdental brushes, you clean your tongue, and then at that point you can either use a mouthwash or like a water flosser or a water pick. Then the electric toothbrush, toothpaste, spit out, don't rinse your mouth out. Few things that you can do is avoid the sugar, avoid the acid, disclose your children's teeth often, and fluoride varnish every 6 monthly at the dentist. Now, if you found the contents of this book useful, you join the Dental Fitness Network, which you all have already joined. You can check out my website. That's rizdentopedia.com. I have given a lot of my patient stories. I'm quite lucky. I get to do a lot of different types of dental treatment because I'm a specialist prosthodontist as well. And so that is dentists in the replacement of missing teeth, which have got a lot of options. So I get to practice a brilliant kind of dentistry that I love. And so you can see some of the pictures of before and after. So if there is a case that you think, is there anybody who's got my problem? What are the treatment options available? You can go check out the patient stories. Riz Recommends is a full list of all the things that I recommend for like sensitive toothpaste to, tooth pain, what to do, or you've got an ulcer, what to do, all those. It's just all the different products. Basically, it's for my patients where instead of me writing it out or sending them links of everything, I'm asking them to just go check the website. I also have gone through 700 plus, or I think it's 800 plus on there now, where research papers which I have actually concised and put so that you can go check. You've probably seen something on the internet. You can search for it using keywords. So if it's fluoride or if it's nanohydroxyapatite, whatever, you can just search for the keyword and that'll bring up the evidences. But also the evidences are put into different categories so that you can go and have a look. And if you're a parent and you're very keen, you can go check up all the evidences I've added there as well. And there's some blogs as well. So don't be like most parents. If you found value, you can join the platform, the Dental Fitness Network on School. What we have there, as you all know, there's a lot of invaluable content. We do weekly calls, and I think as parents, that's one of the best gifts we can give to our children. If you notice, people who do well in life, they either have a good set of teeth, or that's one of the first things that they invest in, because having a good, confident smile, really shows up in their personality. I had braces in my dental school, and I'm not a very compliant patient, so I never wore my retainers well enough. And all my spaces opened up, and it never bothered me until I started doing videos, and I was like, oh my god, that's looking so horrible. So then I went through the Invisalign process of correcting all the gaps, and I had to change a crown. I whitened my teeth a little bit, and now as you can see, it's quite a pleasing smile that I have, and it's given me a lot of camera confidence. Before I started doing these videos, I have actually recorded a couple of videos when I had, I was in the process of changing my crowns and my Invisalign was not complete. And it is, we will discuss about all that at some point. But yeah, a confident smile makes a huge difference, especially in this era of, being video and photogenic. It's so important. Now, something I keep hearing as a dentist is, and with where I do prevention-led approach to dentistry, I wish I knew this before, or I blame my parents for my bad teeth. And unfortunately, both of those statements are true. One is, parents knowing about teeth and teeth problems has been again evidence-based to show that, especially the primary mother, the primary carer, knowing, having one is just general education levels and their socioeconomic levels and their knowledge about teeth. All these can make a big difference on how well their children's teeth are looked after. The decay or the hereditary, how your skin, your hair, everything you get from your parents. Same way, your good quality teeth or bad quality teeth you get from your parents. The kind of bacteria the mother has in their mouth is the microflora that was directly passed on to the child. So it is really important that the mother has good oral bacteria. They are eating healthy food, so during pregnancy. And so it's funny how I see mothers who all through their pregnancy eat sugary food, so it goes through the amniotic fluid. That's what, actually modifies the child's taste perception. Then during breastfeeding as well, they're having a lot of sugary food or unhealthy food, and that's the taste preference that the baby will want and crave. So that's one thing. The second is, when you have this kind of sugary food during your pregnancy, you are cultivating the decay causing bacteria in your mouth. So you are actually creating a pool of decay causing or gum disease causing bacteria, because you're not brushing properly, because it bleeds. You're transferring it all to the baby. So it is really important that, again, we'll go through all this in great detail, but, I just had to mention that quickly. So your parents have a huge role to play in the child's oral health. Knowledge is power, and I understand the importance of starting young. So that's why I have, been now, this is my purpose to spread this message. Again, if you get a good oral hygiene regime, we have less problems. The money we spend more on tools and techniques, tools for cleaning the teeth, the better. So don't think, oh yeah, this is only a child, let me get a cheap toothbrush. No, get the best that you can afford, so that the child does not have a tooth problem, so that there's less money and trauma of the child going through any treatment, because parents usually are more worried. When you have a child and a parent that I'm going to extract a teeth, you can sort of see the trauma on the parent's face than on the child. The child is sometimes a bit more brave. So yeah, instead of going through all of that, it might be well worth in investing time and money into your oral hygiene tools. So most parents I hope you all are feeling inspired, and hope that you will. So the only thing you need to remember is consistency is key. It's an everyday battle. It's an everyday challenge. So you can have a few days off, but it's just not worth it. Just not worth it. So yeah, you can come and you join or ask others as well to join the dental fitness community network. So I hope you all are all finding value in this, and let me know your feedback. Again, so this is where you can find me on TikTok. I'm on YouTube, and again, I need to restart all of these channels because I was doing a lot, and then because it was not getting the kind of traction, I realized that I needed to do it another way, and that's how we are here. So that's all about the little brushes guide and all the tools and tips and tricks that I have explained in the guide. Hope these videos have been useful for you all. If you do have any further questions, I shall see you in the Q&A sessions weekly. Take care then. Bye-bye.